Good morning, everyone. Sorry for the slight delay. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Also Brooks. This morning, we have some very important updates on the COVID-19 virus here in the county, as well as our vaccine distribution efforts. Additionally, the county executive is excited to make some other announcements in terms of the county's beautification efforts as we move past the virus. So first, we'll hear from the county executive, followed by Deputy Chief Administrative Officer for Health and Human Services, Dr. George Askew.
Good morning, everyone. I wanted today to provide an update on our COVID-19 numbers, and as Gina has indicated, thank goodness we are also able to talk about some other work that we're doing in the county around our county beautification initiatives. Before I do that, I do want to thank Dr. George Askew, who is here with me this morning, our Deputy Chief Administrative Officer for Health and Human Services, who you will hear from in a moment. And I don't think I can thank Dr. Askew enough and his entire team. Thank the Health Department for the magnificent job that they have done during this entire year. They are just, a can-do team. Love the optimism and the hard work, and I do just very publicly, because we don't get to do it enough, say thank you so much to Dr. Askew for his tremendous leadership. Since last March, 80,618 Prince Georgians have had confirmed cases of COVID-19. 8,119 of our residents have been hospitalized, and 1,388 members of our community have passed away. And we are ever mindful of the year that we have had. We are mindful every time we talk about it, about the suffering, about the grief, about the loss that we have experienced as a community over the last year. And as always, I want to not only say that we will not forget those who we lost during this time and the families who are still grieving, but I do want to thank Prince Georgians for their resilience and their sacrifices. And thank you so much for your patience and for holding us accountable, and just for being a tremendous community during all of this. We are not yet out of the woods, and what we know is that although we are seeing lots of progress, the tracing data that we've gathered through our contact tracing, especially for the month of March, tells us that family gatherings are still the biggest source of COVID-19 spread in our county. And I have to say, you know what? We understand. We understand that everyone is eager to get back together as a family. We miss each other. We miss the gatherings. We miss the celebrations. And so the message is to be careful, to remember, please, to wear your mask, to remember to practice social distancing, to limit those gatherings if you can. And when the time comes, we want everyone, please, to join us and to be protected from COVID-19 and to get the vaccination. Our Deputy Chief Administrative Officer, Dr. Askew, is going to provide an in-depth update on the status of current COVID-19 numbers in just a moment. But I want to stress that our progress can quickly reverse. You're seeing all across the country places where the numbers are spiking. And so with our vaccination efforts that we are ramping up every day, now is the time for us to still please remain very vigilant. Even as we go through vaccinations and we are ramping up, we're so pleased about where we are with it. But we want you to be cautious, continue to be cautious now so that we can once and for all stop the spread of COVID-19 in our communities and continue to move forward. Again, please remember to follow everything we have learned over this year with social distancing and washing your hands. And just please don't let up quite yet because we're almost there. Over the past few weeks and months, our county has worked hard, and that's an understatement, everyone knows it, to ramp up our capacity to deliver the COVID-19 vaccine. In the past, what we've shared with you is that supply has been a limiting factor in our fight to end this pandemic. That's no secret. I think the numbers speak for it. But we're seeing our supplies of vaccine begin to grow. In fact, I'm proud to announce that our county health department has administered over 100,000 vaccines throughout our sites alone. At the beginning of this week, our county expanded vaccine eligibility in concert with the state, and we are now into phase 3. And all individuals 16 years or older that live or work in Prince George's County and have pre-registered are eligible to receive the vaccine. This means that we'll be able to have those appointments and to go to the county's vaccination clinics. Seniors and individuals with underlying medical conditions that increase their risk for severe COVID-19 illness will continue to be prioritized for appointments. And so although we're open to everyone, we're continuing to make sure that we are getting to our seniors and to those who have those underlying medical conditions, and that we offer the vaccination to them. We're doing so in a number of ways, not only through our sites, but we continue, for those who are inquiring about this, we continue to take those mobile units into areas that are hard to reach in the county. We continue as well. We've gone bedside with many of our residents who have needed this service. So if you have that need, please don't hesitate to reach out to us through 311. If you have a loved one who is immobile, unable to get out and about and needs to receive the vaccine, we are making sure we take care of every Prince George, and we want all of us to be protected from COVID-19. Our county has also worked very closely with our partners to make sure that Prince Georgians can get vaccinated. And so it is not just the county sites that you see, but you should know that our health department recognizes that it cannot do this alone. So far, over 400,000 total vaccinations have been provided to county residents. And we have done this through our partnerships. Now over 267,000 residents have at least one dose, and over 150,000 Prince Georgians are fully vaccinated, which means that 1 in every 5 adults in Prince George's County has received their COVID-19 vaccine. We've been providing names from our county pre-registration list to hospitals and pharmacies, our partners, to get pre-registered Prince Georgians vaccinated as quickly as possible. And so for those who have been really pleased to be able to go to some of the pharmacies, it is those partnerships that is really working out for us. We are part of a fantastic team that is delivering these life-saving vaccines, and that includes DaVita, Kaiser, Luminous, who we want to thank, the University of Maryland Capital Region Health, MedStar, the University of Maryland, the Maryland Department of Health, the ARC of Prince George's, Children's National, Giant, and CVS. And so we're working together as a team. Our county is helping to provide the vaccine to be able to get it out through as many sources as we can. So far, we've had over 212 residents pre-register for the vaccine since we launched our pre-registration list. And of those who have pre-registered, and oh my goodness, this is such a great number, over 68% on the pre-registration list have been vaccinated, whether at the health department or sites operated by many of our partners. We're going to move to get all of those off that pre-registration list, but we have been hampered, as we spoke about before, in the past due to the supply of vaccine. But as we see the supply increasing, we see that our vaccination numbers have absolutely skyrocketed. That's the truth. Is overall, the vaccination numbers have skyrocketed. So a month ago, just by way of example, on March 6th, 94,631 residents had received their first vaccine dose. And as I mentioned, now a month later, 267,000 residents have received their first dose. And if you have not already, please pre-register so that you too can receive the vaccine as soon as possible. Residents who pre-register will begin to receive appointments more quickly because the supply is increasing and we're going to be able to get to folks. And so residents who are interested in receiving the vaccine should pre-register at mypgc.us/proud to be protected. And let me just say this because I've been seeing a bit of traffic about this and I don't know that people understand. Our sites have a capacity that we're able to reach based on the supply of vaccine we get. But don't forget as well that as you pre-register, you're able to get appointments in these other places, the Giants, the CVS, the other places, because we are working with our partners in those places as well. And so even not just county sites, but you're able to also go to Reed Temple, to First Baptist Church of Glenard, and to all of the other places that we are all working together. Residents should pre-register with the state of Maryland at covidlink.maryland.gov. And residents who pre-register with the state will be able to select preferred vaccination sites, including the new FEMA-run vaccination site at the Greenbelt Metro Station. So we were there and launched that site, and you're able also to select that. Now, what we want to tell you about the FEMA site is we want as many Prince Georgians, hear me on this, to get vaccinated at this location as possible. because FEMA, by agreement, has set aside 65% of all of the vaccinations that will be administered at that Greenbelt site will go to Prince Georgians. That's a part of, and again, I want to thank Dr. Askew. It does not happen, in case anybody's wondering, none of this happens by accident. It is because of the work that we've done around equity and working with the Equity Task Force. General Burkhead has done a tremendous job in working with Prince George's County along with the state to make sure that we're closing the gap. There was an equity issue that everyone recognized. And as I've said, we're working on solutions. And so I do want to recognize Dr. Askew for making sure that the FEMA site, the federal site that opened in Prince George, is the first place in the state. But it was there to make sure that Prince Georgians specifically had the opportunity to get that vaccination. And the site is a great option for us. It's great not only because we have 21,000 shots that will be administered there every week. And now I want you to know it's not forever. This site so far is for 8 weeks. So that's why we're saying, Prince Georgians, make sure as you select your site, go to that FEMA site, take advantage of it while it's there. But we'll have 21,000 shots at that particular site. And we want you per week, and we want you to sign up there. But the other reason that site is really great is because those who prefer to take mass transit to get their vaccine are able to receive the vaccination at that site. And so the Metro site was very intentional as well to make sure that those who don't have transportation cars can still be vaccinated there. So if you've not pre-registered, again, no time like the present to go ahead and get registered. We're making so much headway with our vaccination efforts that we're also starting to plan events in the future that this time last year seemed impossible. The University of Maryland and Bowie State University are planning outdoor in-person graduations this coming May. That is cause for celebration and tells us that we are making progress. Our county health department will be working with the University of Maryland, Bowie State, as well as Prince George's County Public School System to ensure that any potential events that we host are held safely with all of the social distancing measurements in place to provide, to make sure that we're preventing the spread of COVID-19. So our health department is very engaged in this process. We're so pleased, though, that some of our graduates will be able to convene outdoors and to have celebrations and to receive their diplomas that way. Additional announcements will be made for all of these entities, and graduation plans will be forthcoming in the near future. I want to also talk about FEMA funeral assistance. We're very pleased with the progress that our community is making against this virus, but we know that we really have to stop also the tragic loss of life that has affected our community over the past year. And so for anyone who has lost a loved one to COVID-19, FEMA is now offering funeral assistance to ease the financial burden that is caused by this pandemic. FEMA has made eligibility for this program very broad. There is no requirement, for example, that the deceased person have to be a U.S. citizen, non-citizen, national, or qualified alien. However, those applying for this assistance should be a U.S. citizen, non-citizen, national, or qualified alien. So the persons who are applying, there are some requirements there, but none with respect to the deceased person. Some basic documentation is required in order to qualify for the program. Applicants should provide an official death certificate indicating that death was due to COVID-19, along with funeral expense documents and any proof of funds received from other sources. Applicants should call the COVID-19 funeral assistance line, and that number is 844-684-6333. Again, it's 844-684-6333. And we'll make sure that information is published so that you can, if you don't have something to write now, that you can go back and get it. The line is open Monday through Friday from 9 a.m. until 9 p.m. And multilingual services are available at that number as well for those who need it. Now I want to talk about renewed beautification efforts and announce that we are renewing our focus on making Prince George's County a beautiful and litter-free community. And I have heard from you, and maybe you've even heard from me, that we together are concerned about this issue. And early on in the pandemic, you should know that we followed CDC guidance and limited our Department of the Environment and Department of Public Works and Transportation employees' work in ways that protected them from COVID-19. And so we were impacted last year because of COVID-19 in the way that our employees could work. And now with a better understanding, however, we wanted to make sure that our employees' health and wellness and well-being was at the forefront of what we did. And now with a better understanding of the virus and appropriate safeguards in place, we're renewing our focus on county beautification. Spring is here, and we care and we are proud of our county and want it to look beautiful. You may have noticed more crews collecting litter on the roads these past 2 weeks, and that is a good thing. You're going to look out and see us coming. So our Department of Public Works and Transportation is working in coordination with the Maryland State Highway Administration, and so far has conducted 2 litter blitzes and a pothole blitz. And as a result of their efforts, the Department of Public Works and Transportation has collected 1,004 tons of litter and illegal dumping to date in fiscal year 2021, and 136 tons of litter was removed in our 2 recent litter blitzes alone. And so our teams are out. They're working very hard. And I want to go backwards and just say one other thing, and to really thank and compliment the Department of Public Works and Transportation. During the pandemic last year, as we mentioned to you, we took some of our folks offline because we had to follow CDC guidelines. But one of the other things that we did was to work at cross purposes with many of our employees who we had to use for cross purposes. We generally serve between 200 and 300,000 meals to our seniors each year. During the pandemic, you can understand that need grew exponentially, and we served over 1 million meals to seniors, and those meals were driven to the homes of seniors by Department of Public Works and Transportation employees. And so the ones who would generally be out behind your snow plow and some of the other plows and litter plows, they were driving meals to the homes of our seniors and delivered over 1 million miles, 1 million meals, along with other sources. Many in our community are unaware when we talk about the partnership and coordination that we're doing. I'm telling you that we are happy we're partnering with the state on our cleanup efforts because to be successful, you should know that our crews are required to work together. When it comes to litter, our county crews are able to collect litter on county roadways. Now, I'm going to say this part because I want you to really to get this with us, is that our county employees can collect litter on county roadways while state crews must collect litter on state roadways. And many in our community are unaware, and you cannot imagine how many people have fussed me out about 210. I'm sorry, not 210, about 214. I want to know why 202 is so messy. I'm sick and tired of Route 4. You know what? I'm angry and irate with the county executive about Route 5. I'm looking on Branch Avenue. I can't believe her. She's awful because she's allowed the litter to collect. Well, these roadways are owned and maintained by the state for things like grass, litter, and snow removal, and the others are maintained by the county. So please help me and tell Lottie Dottie and everybody, if the road has a number on it, it's not a county road. So for those who have called and fussed me out about the whole thing, we're working with the state because it does require partnership. But the debris that you see on those roads is because they're state-maintained roads, and we have to work with them together to collect the litter. Now, we're going to do that, but I just wanted everybody to know, because you can't imagine how many of these people are pissed off with me about Route 214, and who are pissed off with me about 202, totally irate with me about Route 4, and that's just not a county road. So as we saw debris gathering, we reached out to the state. They are working with us, and our work has resumed. The county looks forward to a renewed focus on litter collection, and we're looking forward to continued progress with the state on our cleanup efforts. And along with this spring's Growing Green with Pride event, I have named Tia Rutherford of the Department of Environment as the Prince George's County Litter Czar. So guess what, y'all? I want you to announce that too. Prince George's County has a litter czar, so we're not playing. And I'm creating a litter reduction and illegal dumping task force. We're going to make some more announcements about this going forward, but the task force will continue to work with the state's attorney's office and also expand our illegal dumping camera monitoring program. Y'all have heard me say this before about these cameras. They are mobile cameras that we're able to move around the county. So to let people know I got my eye on them. I got these cameras that we're going to move around, and we're going to take people's picture. And for those who have misbehaved, we're going to send them straight to the state's attorney's office. We have 6 cases right now pending in the state's attorney's office. We know that everything has been slow because of COVID. We're hoping as it opens back up, we'll be able to have those cases prosecuted for those who think that Prince George's is an okay place to illegally dump stuff, like your mattresses and your raggedy couch and whatever else they have dumped. I want you to know also we got our eye on you. We got our camera moving around, and we will be to visit you when we can catch your picture. Now, this task force will also research best practices and benchmarking for litter reduction and dumping mitigation. It will create a quick reference guide on litter and dumping ordinances and recognize community members who work to keep our community clean through the Hometown Heroes campaign. And there are so many hometown heroes that I can think of. I can think of Shirley Latham and the DuPont Village group who is out there, and they have been out even during COVID, cleaning our streets and making sure that their communities are beautiful. And over the long term, our task force will also launch a customer dashboard and map showing litter routes and mitigation activities across Prince George's County. And I'm very excited about that part. I know that we're going to talk more about it, but what that dashboard will help us to do is when we have a snow event, we have an app that our residents can go on, and it will tell you where the snow plow is at any given moment around the county, so you'll know when it's coming to you. And the thing that the customer dashboard and map will show you is where our trucks are collecting litter on any given day in the county, and so that you can go right on the app if you're wondering whether or not it's going to be on your road, provided again it's a county road, provided it's a county road. If you want to know where that truck is on any given day, yeah, you can look on that dashboard and it'll tell you where we are. In addition, we're going to review new and innovative policy initiatives for litter reduction, push forward with data-driven enforcement activities, and continue our award-winning coordinated communications campaign to reduce litter across our community. Over the coming months, we'll continue to keep our cleanup efforts in overdrive. But what I want to tell you is that we cannot do this work alone. As in past years, we're planning for our biannual Growing Green with Pride event. That event is scheduled for May 1st. So for all who are able, please put that on your calendar. And so far, we have a number of community partner groups who have already signed up. And yes, there is still time for those who are asking right now, how can you register? There is still time to register a group so that you can receive the bags, gloves, litter pickers, and mulch. And sign-ups for Growing Green with Pride are still open. And this is an excellent COVID-safe way to get outside and give back to the community. I'm encouraging everyone to please join with community groups and organizations, neighborhoods, and even friends to join us in this community cleanup. So far, we have 22 groups, 1 school, and 1 municipality, which includes 331 adults, and 138 of our students have even signed up to volunteer. And you can learn more and register at mypgc.us/growinggreen. And we'll provide that information on our sites as well. But it's mypgc.us/growinggreen. Our county will continue to devote resources to removing litter from our roadways. And at the end of the day, litter is, however, a community issue. And much of the litter that we see on our roadways comes from our residents. You've heard her say we picked up 735 pounds of litter. And so that is, I encourage every member of this community to help us to please keep things clean by disposing of their waste in the proper place. And I know I've heard from you also that we're continuing to make sure that the people who litter and pollute our roadways, not only that, but the median strips with your signs, your advertising, all kind of stuff that you can power wash, that you can steam wash, that you can do whatever. Those signs do not belong in our median strips and on our signs, and it costs the county millions of dollars every year that we spend going out, picking up people's signs where they're advertising how they can tutor you, they can power wash your deck, they can do what help you sell a house or any other thing. Those things do not belong, those advertisements, and I want you all to know that we spend millions of dollars picking up those signs every year, and we're taking down phone numbers. One of the things we're doing was sending out text messages to those people asking them please not to advertise again in our areas, and we'll continue all of our efforts. As a last note, I want you to know that Brown Station Road Sanitary Landfill, located at 11611 White House Road in Upper Marlboro, is open to the public Monday through Saturday, and that is between 8 a.m. and 3:30 p.m. And individuals may bring their trash here. for no charge. That includes household hazardous waste and electronics, and that's Thursday through Saturday. And we encourage all of our residents to take advantage of this resource to help us keep Prince George's clean. So I want to thank you again for joining us for all of these important updates. And if we all continue to work together, I know that we will be able to safely move forward, that we can stop the spread of COVID-19 in our community. We've said it once, we'll say it again, that COVID-19 absolutely will not have the final say in Prince George's County. We're so really optimistic and pleased that we are going to be able to move together and to come back together safely soon. And we'll continue to provide these updates on our efforts to stop COVID-19, vaccinate Prince George's County, and finally, once and for all, to put this pandemic behind us. So now I'd like to welcome Dr. Askew, please, for his update. Thank you.
Thank you, Madam County Executive. And actually, I didn't know you were going to mention the meals because I just want to further highlight that partnership with the Department of Family Services and DPWT. It was actually 1.6 million meals, 1.6. Tremendous effort on behalf of county residents done by the Department of Health and Human Services and also DPWT to feed our seniors during the pandemic. And we're all very proud of that work. And good morning, everyone. Always a pleasure to be here to speak with you. Around this time a year ago, Prince George's County was in the throes of a rapid surge in COVID cases, hospitalizations, death, and a lot of fear. We were hit hard, but we fought back hard too. Our resilience as a county truly, truly showed. Today, we're in a different place. We're stronger and also wiser. And that's what we need to keep going a little bit longer to defeat the pandemic. The way forward, of course, is getting vaccinated and staying safe and being smart about being safe. So first I want to start with an update on the virus in the county. The number of cases reported each week remain high, but thankfully we have not seen a spike like some other parts of the US are experiencing. About a month ago, our weekly case count did actually go below 1,000 per week for the first time since October 2020. As of late, the last 3 weeks, over 1,200 new cases have been reported, but that's been actually fairly flat considering spring break and the Easter holiday. Now with spring break and the Easter holiday behind us, we're hopeful that the cases are not only going to continue to level off, but are trend down as we move forward. And I was speaking to some folks earlier. This is actually quite a surprise for me in some respects, and it's a very happy surprise and makes me cautiously optimistic and also makes me proud of Prince Georgians in that we're not seeing at this point the kind of surge that we thought we might see after spring break and after the Easter holiday, which really means people paid attention to being smart, being proud to protect themselves, being proud to protect their families from the pandemic and mitigate and do things to mitigate the spread. So again, while our numbers continue to be high, we have to continue to be vigilant. Our numbers are not where they could have been after such a season upon us. Our average daily case rate is hovering around 19 new cases per day per 100,000 folks. And this is still, again, a bit of a high case rate, but we've been able to stay below 20 cases for the last week or so. And again, that number, while it bubbles up and down, it's actually starting to trend down in the face of being post-Easter, which again, I think is terrific. As for the COVID test positivity rate, the county has been in the 5% range since late March, and right now we're sitting at about 5.2%. And again, that has continued to stay in that range over the last couple of weeks, which has been terrific. That's roughly, though, a full percentage point higher than we were about 30 days ago. So we hope to start heading back towards that level. We have not seen, again, a large increase, but we still want to be below 5% as our target. Before I move on to a little more data, though, I need to pass along some very important reminders about feeling sick and testing. Let's not forget that we are still in the pandemic. If you feel sick, do not go into work and do not engage in any social activities. You may have COVID. Please get tested as soon as possible if you feel sick or if you think you have been exposed. Tests are readily available, continue to be readily available. And as of a couple of weeks ago, the state opened a mass testing site at the City of Praise Ministries in Landover. Our health department continues to team up with community partners to offer free tests at 3 sites in Laurel, Hyattsville, and Fort Washington. Plus, there are a host across the county. So if you go to our testing site locator at mypgc.us/COVID testing, you'll be able to find out where you can get tested if you feel like you've been exposed or you know that you've been exposed or you feel sick with any of the symptoms of COVID. It's a long list of symptoms. I'm going to read them off again just to remind folks of what to look for. Fever or chills, cough, difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Again, sounds a whole lot like what you get when you get the flu. Sort of a typical flu-like symptoms, similar to the symptoms you might see if you have COVID or think you might have COVID. And as allergy season begins, we don't want people assuming that that's all they have, right? Keep in mind that COVID is still in the community. Your allergies may be acting up. If you see anything that's at all different than what you have experienced before with your allergies, think COVID, get yourself tested, or at least talk to your healthcare provider. If you're positive, we are recommending that folks isolate for 14 days. If you look at the CDC recommendations, they'll make a lot of different recommendations for different folks in different circumstances, 7 days, 10 days. We're in order to make sure that we cover the most sort of cautious and conservative approach, we're recommending that folks take that 14 days of isolation if they're a positive case. If you're a negative, again, continue to take every COVID safety precaution if you're in public. And always, please, please, please remember to wear your mask. So back to our key metrics to give us a continued sense of where we are in the county with COVID. The county's infection rate, or how often COVID is spreading from person to person, is just slightly above 1 right now. We are at 1.01, which means a person affects another person just slightly more than one other person. Again, that's the reason we're starting to see our numbers flatten out, and we think soon we'll start to dip as long as we don't get that post-holiday rush. A month ago, we were slightly below 1. Again, we're hoping to head back in that direction. The virus and its variants continue to make a lot of people very sick. As of yesterday, the number of people hospitalized due to COVID-19 in the county was 156. We haven't really been below 100 since mid-March, so we did see a spike in hospitalizations, but our hospitals and our healthcare systems and our healthcare heroes continue to do amazing work. They're saving lives every day and providing the best care when residents need it most. Almost half of hospital beds countywide are still available. That's great, 50% capacity available. Thanks to the capacity that was added by hospitals at the beginning of the pandemic when we were having our most significant surges. So right now, COVID-19 patients make up 14% of the total hospital capacity in the county. So if you do get sick with COVID or anything else, we have the capacity to take care of you. We have the wonderful capacity within a tremendous hospital system to take good care of you, which is great. And I would say not just good care of you, great care of you. Our journey out of this pandemic has been prudent and data-driven. We continue to say we follow the data. Our numbers clearly show the journey is going to take a little bit more time. The good news is we know what works. And thanks to our vaccination effort, we're much closer to the end. We must keep wearing masks over our noses and mouths in public, stay at least 6 feet away from people who we do not live with, keep washing our hands as much as we can, avoid crowds and traveling, and having get-togethers or parties with those we don't live with must be avoided for the time being and moving forward until otherwise notified. The county executive mentioned some very exciting data in her remarks. Approximately 20% of the county's population, 16 and older, is now fully vaccinated. and 267,000 county residents have received at least one vaccine dose. Therefore, we are now more than halfway to our summer goal, which was having 65% of residents 16 and over receiving at least one dose of vaccine. Our health department and Office of Emergency Management now operate 6 vaccination sites across the county, as well as 3 mobile units. Our community partners in the state have been vital to this historic effort as well, and we thank them. They have ramped up capacity and carved out appointments for our residents at their clinics, as the county executive explained earlier. Now that we have rapidly built up our infrastructure over the last several weeks, we are excited, as the county executive mentioned, to move into phase 3. We encourage anyone 16 and older to get vaccinated, but we are prioritizing appointments for people with pre-existing conditions, as well as, of course, our senior citizens. As of today, over 2/3 of residents 65 and older have received at least one vaccine dose. Over 2/3 of residents 65 and older have received at least one vaccine dose. We also remain focused on reaching populations suffering the greatest social, economic, and health challenges in the county. Thanks to our local and state partnerships, our mobile clinics are out and about nearly every day. I think we took Easter off, vaccinating hundreds of people and those who need the most help getting access to vaccines. This week, as directed by the state, we announced we are pausing on giving out the Johnson & Johnson vaccine. Federal health agencies are investigating and reviewing a small number of reported cases in the U.S. of folks experiencing a rare but severe blood clot after receiving the Johnson & Johnson vaccine. This pause also ensures that the medical community is aware of these reports and can plan for proper treatment of patients who may present with certain signs or symptoms. We ask you to please call your health provider if you got the Johnson & Johnson vaccine and within 3 weeks afterwards you develop a severe headache, abdominal pain, leg pain or swelling, or shortness of breath. And I think in one case they actually reported some back pain as well. So these are things to keep an eye out for. If within 3 weeks of receiving the Johnson & Johnson vaccine, any of these symptoms appear, please contact your healthcare provider. Our goal, of course, is always to ensure any vaccine given to our residents is safe and effective. So we will stop administering Johnson & Johnson until we get more guidance from the FDA and the CDC. Keep in mind, there have been nearly 7 million Johnson & Johnson doses given in the United States. So far, there have been 6 reports of people getting this rare condition. There may be additional reports on the horizon, but so far confirmed that I know of 6 cases out of the nearly 7 million doses that have been given. But it is vitally important, even though this is a rare occurrence, it's vitally important that this pause happen so everyone is aware and independent scientists can properly assess the situation. No appointments at our clinics are affected by this stoppage. Our current supply of Pfizer and Moderna is enough to accommodate those appointments that we have scheduled and allow us to continue to move forward at the pace of vaccination that we have been as long, again, as that supply itself continues to exist. There have been no similar reports of side effects from the Pfizer or Moderna vaccines such as this, and we will continue to administer those, of course. But if you get the vaccine, don't be surprised if you feel a little achy, particularly at the site of the injection, or tired following your shot. You may get a little nausea, you may get a little fever. Again, symptoms, signs that the vaccine is actually working and producing an immune response in your body so that it can fight COVID in case of future exposure. These side effects are normal, and they will most likely go away within a day or so. Once you get vaccinated, it's a great thing, but you still must keep your mask up and keep your distance from others in public. There is still a risk you could spread COVID-19 to others. While you are less likely to get sick with COVID, less likely to get COVID, you still may be a vehicle for giving other folks COVID, even though you are vaccinated. And finally, I again want to thank Prince Georgians for their motivation to get vaccinated. It's really showing. It's making a difference. We could not have reached these milestones without you. We truly could not have reached these milestones without the efforts of our community. So thank you for being proud to be protected. We are making public health history together, and we can't wait to cross the finish line with you. Thank you.
Thank you, Dr. Askew. So with that, we will take any questions. Brad.
So we are considering the walk-up option. I know that's something that our team has been working on, and I know Dr. Askew can talk a bit more about it. But we are absolutely considering walk-up events. We're also planning, and we're very excited about working with the Commission on Fathers, Men, and Boys. They have a number of activities that they're planning. I believe there are 18 all total that they're planning in the coming weeks and months to get the men of our community vaccinated. Those efforts will include what I believe they're planning is an all-night vaccine-a-thon sort of event, and they're planning just a number of events to make sure that that everyone can get protected. We're also continuing with our efforts with the mobile unit to get that mobile unit out into the areas that are hard to reach, and we're looking at data, including zip codes, that will tell us the areas of our county where we are seeing lower vaccination rates. We use that data to help us schedule the mobile unit, and we will take that mobile unit. We've already used it in some of our areas. We noticed Suitland, for example, District Heights. We've noticed some other areas in the county where we were concerned about the vaccination rate based on zip code, and we just schedule over the weekend. We're also doing things like going out now. I'm very proud that we're working to make sure that those who had to come out and who were first in line to get us services, those grocery store workers, we're working with our transit workers, some of the others who, when the rest of us were afraid and had to be home, they had to be out there working. So we're making efforts also to actually take the vaccine to those individuals, hotel workers and others who were in need. So we're doing a number of things. I don't know, Dr. Askew, whether you wanted to add anything to that, but we're really just making sure we push out all across the community. I'll let Dr. Askew.
Well, I would say it would be a disappointment, but one of the things that we've been most proud of is our ability to be nimble and to make adjustments. And as I said, the lack of Johnson & Johnson, because it was such a small percentage of what we were giving out in the first place, doesn't really impact our plans overall. And what it, we were planning to use it more on the mobile van perhaps, but that just means we'd have to make another trip with the mobile van to get back to folks who we reach, because we're still going to be reaching the same folks. It just means an additional trip, means that we'll work just that much harder. But again, nimble, focused, and it really won't make that much of a difference for us.
So we have been really trying to work with our business community. We are concerned and optimistic, though, that we believe that we're going to be able to really rebound very nicely in business. As you know, we continue to support the business community. We provided about $41 million in aid to our businesses. We're laser focused on making sure that we retain the businesses that we have as we seek to draw more in. But we want to make sure that everything we do is sustainable. We believe the worst thing that can happen is to continue to open up prematurely and have to close again. So what we want are sustainable decisions as we go forward. We're making sure that we're watching the numbers, watching the data, and we're concerned about not only protecting people, but making decisions that are data-based and science-driven, and decisions that are sustainable. So we'll continue to monitor, and as the numbers tell us that it's wise to do so, then we'll open a little bit more. But in the meanwhile, we are working with the businesses. We have a whole campaign right now, for example, asking the public to go out and support the businesses. So we're working together, but we absolutely want to make sure that we are safe. And it's not just, we're making sure they're safe as well. There are many, many workers who don't have a choice about going in or not. And so these numbers keep not only the public safe, but it keeps our workers safe who go into these restaurants and have to work there and earn a living. We want to make sure that we're making good public health decisions for them too. Well, right now, the future that I have is I'm going to continue to work for Prince George. And so my intention in this moment is to work as hard as I can to continue to not only get our public vaccinated, but to make sure we can emerge stronger and stronger from this pandemic and, and to fulfill the promises that I've made. So we're excited about, where we are. And, I'll say more as I have more to say to the public. But in this moment, I am, laser focused on the job that I promised that I would do here, and I believe we're headed somewhere. So. I'll ask Dr. Askew to answer.
We have not received any specific reports of anyone either having the clotting issue nor severe symptoms from the Johnson & Johnson vaccine that have been reported to us. It would, of course, go to the vaccine reporting site, the nationwide vaccine reporting site, and would eventually get to us at some point. We have not heard of anything like that.
Dr. Askew, we have the final question from Will.
Oh, sure. Okay.
Family gatherings has been talked about. Candidate also both mentioned why people should come down and just be patient. But from a health perspective, can you explain and remind us why family gatherings shouldn't be done as much as of right now?
Sure. Family gatherings are very intimate settings. Folks get close together, especially if you're not vaccinated and folks don't live in your household. The recommendation is that folks within the same household, of course, can be together. And folks now, the CDC is saying, if you're in a household with other folks who are also fully vaccinated, again, everyone fully vaccinated, that's an okay gathering. Or everyone fully vaccinated and anyone who is not fully vaccinated having very low risk for serious outcomes. That is not the case in the majority of households around the county, around the country. Family gatherings are extraordinarily risky, wonderful for us emotionally, very risky for us from a COVID standpoint.